Excellencies, distinguished participants, colleagues and friends, good morning, good afternoon and good evening to all of you. Thank you for joining us for the keynote session of PMAC 2022. Isn't it so moving to see all the happiness, but also the concern of the children in the video in the opening session just now? My name's David Harper, and I'm a senior fellow at the Global Health Programme at Chatham House in London in the UK, which is where I'm sitting right now in my office at home. It's such a huge shame that, for fairly obvious reasons, once again, we aren't able to get together in person in Thailand. We'd hoped that it would be possible this year, at least to have a hybrid meeting with some of us seeing each other in person. But we're all very used now to the virtual platforms that we have at our disposal and that we've been using to great effect over the past nearly 2 years. I think I personally have learned a great deal about how to use Zoom and WebEx and all of the other platforms that we use these days. And this certainly provides a much needed opportunity for the PMAC family to get together to carry on its great tradition of tackling the key challenges we face as a global community. The PMAC theme this year is the world we want, actions towards a sustainable, fairer and healthier society. And I'm sure we're all looking forward to a very timely and relevant conference with everything that's going on in the world right now. And with what promises to be an exciting few days of truly excellent presentations and discussions. What better place to start than with this armchair conversation, during which we have an opportunity to consider the COVID-19 pandemic, of course, and its relationship with the mega trends that Dr. Tedros just touched on in his opening comments. And these mega trends will shape the rest of this century, and they relate to each other. There's a complex interplay between them. Amongst other important topics, I'm sure we're going to touch on global health architecture, on geopolitics, demographics, the imminent and evolving threats to global health and well-being posed by environmental degradation and climate change, and of course on inequalities and human rights. And joining me in this conversation for the next hour, I'm delighted to welcome the Right Honourable Helen Clark, who is currently the chair of the board of PMNCH, the world's largest alliance for women's, children's and adolescents' health and well-being. She's also the former administrator of the United Nations Development Programme and the former Prime Minister of New Zealand. I'd also like to welcome my good friend Margaret Chan, the founding dean of the Vanke School of Public Health, Tsinghua University in China, and the former Director General of the World Health Organization. And also very much like to welcome the United Nations High Commissioner for Human Rights and the former President of Chile, Her Excellency Dr. Michelle Bachelet. Each will start with a short opening presentation. And could I encourage you all to use the Q&A function for any questions you might like to pose to the panelists or any comments you might like to make. So first, and without further ado, could I hand over to you, Helen? Thank you.
Well, thank you, David. Good evening, everyone from New Zealand, and great to be on the panel with two old friends, Margaret and Michelle. Greetings to you both. I was going to start by saying that before COVID-19 turned our world literally upside down, there were quite a lot of good things happening in international development. And at the Partnership for Maternal, Newborn and Child Health, of which I'm now chair, having succeeded Michelle Bachelet in that role, we acknowledge the many improvements that were happening in women's, children's and adolescents' health. For example, if you looked at family planning access, an additional 60 million women and girls were able to use modern contraception between 2012 and 2020. You look at child immunisation. We were saving more than 5 lives every minute, preventing up to 3 million deaths a year pre-COVID-19. We had more women able to give birth with safe, skilled attendants with them. So many things were happening that were positive in this area. But of course, we weren't taking everyone with us. We still saw in 2017 around 300,000 women and girls dying from complications of pregnancy and childbirth each year. In that first year of the pandemic, almost 5 million children under the age of 5 died of causes other than COVID. So not everyone was being able to benefit from the progress. And then when COVID descended upon us, it not only made pre-existing health and other inequities worse, it also created new ones, including by blocking access to essential health and social services for many, and of course severely impacting on livelihoods. We can't yet exactly measure the full impact of the service disruptions on maternal and child mortality rates, but it seems certain that hard-won progress did unravel in places where health systems lacked resilience and where there wasn't basic social protection, or where the social protection that people had became unavailable. Obviously, quite a lot of implications too for gender equality. We know that women became unemployed at a higher rate than men during the pandemic because of the nature of the occupations that they had. And let's also remember the increased vulnerability of women and girls to sexual and gender-based violence during those lockdown periods. So the global response to the pandemic and to the damage that the pandemic has caused really is a chance to put things right. But to date, it too has been characterised by many inequities. And the one we hear the most about, and rightly so, is that around the supply of vaccines. The catastrophic inequity there really damages all of us, because we can't end a pandemic if we continue to leave so many people behind in the fight against it. So you asked the question, as I'm sure the children were asking us, is that the kind of world we want to live in? Well, obviously not. Now, PMNCH has been calling on global leaders to protect and prioritise health and rights of women, children and adolescents during the pandemic response and recovery phase. We've called for stronger political commitment, policies and funding for vital services, and have had some wonderful commitments by a wide range of countries. As well, out there on the table is the report from the Independent Panel for Pandemic Preparedness and Response, which I co-chaired with President Ellen Johnson Sirleaf. It's a bold agenda. It covers everything from governance to financing to new legal instruments to provision of global public goods and strengthening WHO, all in the hope that we could have more effective pandemic prevention and response. We strongly recommended that vaccines, therapeutics, diagnostics, and other goods and technologies which we need to fight pandemics should be seen as global public health goods, and they should be funded and allocated accordingly. And let's put it bluntly, the human right to health demands that everybody has equal access to these goods. Access shouldn't be limited to wealthy countries who can pay top dollar and buy more than they need. That excludes others. So some big issues to grapple with as we try to climb out of this pandemic. But let me end by saying, will we as a world be able to look back on this year, 2022, and say that this was the time when countries regrouped and came together to fight the pandemic and its consequences and to get the Sustainable Development Agenda back on track? Or will it be another lost year of widening inequities and too little solidarity, which would have the impact of putting the Sustainable Development Goals beyond the reach for so many? I think the choice is in our hands collectively, and listening to the children, I think we all have to say, let's make the right choice. Let's not keep blundering away from where we'd like our world to be. Back to you, David.
Thank you, Helen. There are so many points that you've already just raised, but I think what we'll do, if we go through the speeches now, and then we'll be able to come back and pick up some of those in a few moments. So could I now turn over to Margaret Chan, please? Margaret.
Thank you, David. Nice to join Helen as well as Michelle, old friends from the United Nations. Well, distinguished participants, friends, ladies and gentlemen, let me begin by recognizing the amazing resilience of all peoples in the world. I know you are tired, very tired, but you are very strong. As we are speaking, countries and areas, including Hong Kong, China, we are struggling with a new surge caused by the Omicron variant. The current pandemic has exacerbated the fragility of trust and international governance that was referred by Helen, and the weaknesses of our global systems, particularly the health systems, and the weaknesses of the silos approach in health and economic development. Allow me to propose 3 priorities that should guide health policies and programs going forward if we are listening to the children. First, we really need a new and fully financed, I call it international emergency cooperation mechanism. Some people call it the pandemic treaty. It doesn't matter. Name, you can call it whatever you want. But in order to prevent the next pandemic and to tackle common health challenges, this is an urgent need. The saying, no country is safe until every country is safe, is vindicated. A new mechanism must be negotiated through genuine multilateralism with solidarity at heart and with a strengthened WHO. The new mechanism must focus on social justice, equity, and fairness. Never again should the world experience another vaccine nationalism, the biggest health inequity ever. The second point I wish to make is we must move towards universal health coverage based on primary health care to leave no one behind. No doubt the current pandemic is occupying our attention, but we must not forget there are other health challenges in the community, like women and child health, like aging, of which I'm qualified, AIDS, TB, malaria, malnutrition, and non-communicable diseases. Countries require resilient public health system for population health to detect and prevent the next pandemic, as well as to provide healthcare that is affordable, community-based, and people-centered. We do need an affordable universal health coverage based on primary health care because that is fundamental for health. And the SARS and COVID-19 experience have shown very clearly that both the public health systems and the hospital system must be well coordinated and well managed, of course, at all times, particularly during a crisis. The last point I wish to make is we must invest in systems beyond health. Dr. Tedros make reference to that. We must adopt a multidisciplinary approach for health and for development. In the face of multiple threats like pandemic and the climate change, there are many things that will undermine human progress and economic development. The health of humanity must take a comprehensive perspective. Human health should not be seen in isolation. It is closely related to animal health, to the environment, to biodiversity, and our planet Earth. In order to achieve better outcomes for health, of course, I mean health, but also for social economic development, and for people in particular, we must have new thinking, we must have multidisciplinary research, and integrated solutions. One Health was often referred to recently, but mind you, One Health was, started many years ago, and WHO was one of the partners in this important initiative. That is a good place to start when we talk about multi-sectoral collaboration. So, ladies and gentlemen, in closing, we must remember our young generations. Today is our best day for me. We heard from the children. We heard what they are happy about and what they are concerned about. So I hope we must invest in our youth, particularly women, and cultivate them to be responsible future leaders with integrity, courage, professional skills, multidisciplinary thinking, and humanity at heart. Thank you.
Thank you, Margaret. As always, very thought-provoking. I'm just wondering how we get to grips with so many things that need to be done, but maybe that's for our discussion in a moment or two. Could I now please hand over to Michelle? Thank you, Michelle.
Thank you, David. Very happy to be here in this panel and to see you and our other great friends, Helen and Margaret. And thanks, of course, to the Prince Mahidol Award Foundation and its partner for convening this event. It's a pleasure to be participating, but also, by the way, great video, because sometimes you feel that facts don't change people's attitude and don't change people's mind. I hope that the emotion that you have while seeing this video can help some people really think what the urgent action, how urgent action is needed to be able to maintain humanity and a planet where everyone could be in a better, healthier, and sustainable society. As all of us have mentioned, the world is at a critical juncture. We are entering the third year of the COVID-19 pandemic and at a halfway point in the 2030 Agenda for Sustainable Development. And we are, of course, encountering serious setbacks. The triple planet-wide challenge on climate change, pollution, and biodiversity loss is harming communities and human rights across the world. And the pandemic has torn societies apart, left millions without their loved ones, and exposed and exacerbating existing inequalities. At the same time, we can and must turn this crisis into a window of opportunity to explore a future that is fairer, healthier, and more sustainable. To ensure our survival, to recover better, we must learn lessons from the pandemic and the environmental harms that we're suffering. And the most central of them is that human rights provide a powerful set of tools for states and societies to respond to threats and crises. As a former head of state, I have seen directly that human rights produce better policy outcomes. Human rights protects people, especially the most marginalized and discriminated, who are often most impacted during crisis. We have witnessed far too often the dreadful cost of inaction and neglecting human rights. The global inequity in access to COVID-19 vaccine, as has been mentioned by my two other colleagues, reflects entrenched and systemic inequalities and discrimination. It is profoundly unjust and, of course, deeply counterproductive. Vaccine inequity is also leading to highly divergent recoveries, pushing less developed regions and countries further behind. But we need states to urgently prioritize action through COVAX to ensure that vaccines reach everyone, barriers including cumbersome and restrictive licensing processes and export bans preventing the necessary flows of vaccine needs to be addressed and, as far as possible, eliminated. Steps towards a trip waiver are welcome and encourage states to pursue this further in discussions at the World Trade Organization. States and relevant stakeholders should also be working towards integrating a human rights-based approach in the prospective World Health Organization Convention, agreement, or other international instruments on pandemic prevention, preparedness, and response. Selfish, narrowly national approaches will only prolong this crisis. As Dr. Tedros has reminded us, no country can boost its way out of the pandemic. So we need collective action for the common good. The effects of COVID-19 and of climate change have made evident how interconnected our lives and rights are. No country can respond to these challenges alone. We need increased global solidarity and partnerships among states, international organizations, civil society, and private sector. As laid out by the UN Secretary General last year, the so-called Our Common Agenda calls for renewed solidarity between peoples and future generations, a new social contract anchored in human rights. This new social contract is about restoring trust and about building the foundation for societies that more equitably share power, resources, and opportunities. The world we want has an economy that enhances human rights and works for everyone. We need to reinvest in economic and social rights. We must create more effective and inclusive social protection measures, develop universal access to healthcare, and ensure the enjoyment of the right to education and work. With these measures, we can reverse development inequalities, alleviate poverty, and raise the status of women and girls. Public health policies now and in the future must place human rights front and center, and they need to encompass and prioritize the needs of the most vulnerable and disadvantaged. Government should be ensuring much wider civic and democratic space so that everyone is empowered to raise their voices, including critical voices, and participate in creating the most effective, most relevant solutions for their communities and nations. I deeply deplore the backlash we have seen in some states against civil society groups and perceived criticism. The world is at a crossroads. Can we come together to change this course? If together we can stock on our failures in managing the pandemic and learn from our mistakes, we can emerge in a stronger position to tackle the next crisis. I strongly urge states to build today's response and recovery policies on a firm ground of human rights laws and standards, because the next disaster will not wait for us to do so. We can still rise out of this crisis with measures that prepare and deliver a more equitable, sustainable, and resilient world. By placing human rights at the center of our response, we can achieve the world we want. Over to you, David.
Thank you very much, Michelle. I'm just scribbling down a few of the words that you all used, and we have some questions in the Q&A box, but let me kick things off with really coming back to some of these words that all three of you have been using. The ones that I want to start with really are these words: global solidarity. It means all sorts of different things to different people, and one of the lessons we've certainly learned to our cost from the pandemic is that whilst maybe scientific solidarity has been evident and working very well in all sorts of ways, it's sadly lacking at a political level. And so the global solidarity that I think many people have in mind is this political global solidarity. And I just wonder, it's hard really to get to grips with it conceptually. For me personally, it's such a big issue. We've talked about it for many, many years through my working career. We only have to look at the inequitable distribution of vaccines across the world, mentioned by all of you, I think, but mentioned by the children in their video earlier. And I think 85%, or a figure around 85% of the population of Africa, for example, is yet to receive one dose. Other countries are talking about second booster doses, so a fourth dose in many cases. And it really is, to me, quite mind-blowing as a public health professional and as a global health public health professional. So the question is a relatively simple one to ask, and I'm very interested to get your views. Global solidarity at the political level, is it a step too far? Is it possible? If it is possible, how do we really begin to work together to move the politicians at a national level, at a local, regional level, but in this global sense? How do we move the politicians towards more global solidarity? So perhaps, Helen, with your former PM hat on, or as the former head of UNDP, you've seen this from all sorts of different angles. What's your view?
Well, I think I'd turn it around and say, if we can't get it on health, what on earth can we get it on? Because, nothing is more important to every single one of us than our health and well-being. And we have an existential crisis that's taken millions of lives, caused millions more of long COVID sufferers, disrupted economies and societies. If we can't come together to deal with this, what on earth would we come together on? So we should see this as an opportunity, really, to show that the world can work more effectively together. I would like to see the UN General Assembly pick the issue up and throw its weight behind a reform agenda so we can do better next time, as it has traditionally with HIV, non-communicable diseases, universal health coverage. I think that would be important. I think the World Health Assembly needs encouragement to work harder and faster to do some of the things that need to be done. And critically, and I think Michelle mentioned World Trade Organization, look, if we can put aside intellectual property rules to get on top of HIV/AIDS, what is holding us back here? I think it's disgraceful that for rather more than a year now, India and South Africa have been trying to progress this TRIPS waiver for the goods needed to fight the pandemic. And this is being fiercely resisted. They got nowhere, really. And at the base of the inequity is the inability to access the technology and innovation to get these vaccines produced at scale around the world and provide them, for everyone at a reasonable cost. So we have opportunities to get it right across the General Assembly, across the World Health Assembly, across the WTO. But countries need to pull together and say, we could make this the last pandemic, or we could keep making these mistakes.
Yeah, thank you, Helen. Let me ask Margaret, with all of your wealth of experience as the former head of a huge, the global leading health organization, World Health Organization. I know you've seen firsthand the challenge of different countries approaching issues from different perspectives, but perhaps saying one thing and then absolutely doing something else. So the words that we all hear are very important, and it's a starting point, but then countries and leaders go off, governments go off, and they naturally have their responsibility to their own populations. And this seems to create this tension between the global good and their first responsibility of looking after their population. So you've managed this, Margaret. I know it's been a challenge. I've been involved in some of those discussions, but how do you see the situation?
Thanks, David. And I think, I like to start with what Helen has just said. I mean, at the global level, the United Nations General Assembly, the World Health Organization, and WTO need to tackle those problems that Helen has just mentioned. Now, coming back as a former Director General of WHO, I think we need to start with people's health. That's a very good place to start. Now, we talk about there's no lack of resolutions in the WHO in terms of a resilient health system, how to tackle population health and individual health and the health systems. But exactly as you said, countries do not keep their promises. And this is not new. This to me is deja vu. We deal with it on a regular basis. It is a failure in both the developing and the developed countries. The developed countries do not want to provide the resources as they promise, and the developing countries do not want to build up the systems that are required for maintaining good health. Now, the good place to start is the opportunities that was referred to by Helen. Can we start with mutual respect and then have a good dialogue so that you can understand each other's where you're coming from, where your interests are? Can we make some compromises and to arrive at a consensus for the sake of people of this world? I mean, it's no easy answer to that, but it is something I really hope this time around. The wake-up call is too loud for countries to ignore. It's not to say that there were no previous wake-up calls. There were many, but this got to be the loudest. And I want to congratulate Helen as well as President Sirleaf for a wonderful report. Thank you.
Thank you, Margaret. Yeah, I think couldn't agree more with this. There's no lack of resolution. The organizations, governments, the intergovernmental groups, G7, G20, many things are said, but here we are at the point that I referred to earlier, where we all know that the pandemic has to be tackled at a global level. Dr. Tedros and colleagues at WHO couldn't make that point more clearly. And yet we have large parts of the world yet to have access or to have received even one dose of this important vaccine. So it really is, it's a struggle. Many things said, but maybe the actions that people I think would like to see have a lag phase, and we really don't have the luxury of having this lag phase, I think. But Michelle, let me come to you, because you've got different perspectives as a former leader in Chile, a political leader, but also in your current role as the High Commissioner for Human Rights. We want to embed human rights. We keep talking about inequalities, inequities. I can't say any more to add to what Margaret, yourself, Helen have already said on this vexed issue of inequities. But what's your view? How do we maybe tackle this issue that's wrapped up in global solidarity to a large extent? Michelle.
Well, David, I have thought about this for a long time. As former minister, as former president, but as former executive director of UN Women, and now in my current position of High Commissioner of Human Rights, because you see so many, as Helen and Mark have said, you see so many resolutions passed that are perfect, so many, messages, so many speeches that you hear in different places that are perfect. Every time I was sitting there in the assembly somewhere else, I was saying, okay, people would hear this discussion will feel, oh, the world is perfect. Everybody really wants to do the best. Everybody believes that human rights are fantastic, they are essential, but reality is different. So I've been thinking about this for many years, how you convince political leaders that of some things, and how can you create, first of all, an individual conviction, but then that could lead to I would say, a global solidarity, a global perception that action is needed now, and we have no more time to wait. And I have to say, we need to understand that this is all, the pandemic came in a context of really weakness of the multilateral system, where very important leaders of the world were speaking against multilateralism. Not only doing a nationalist approach to the pandemic, but even speaking against the multilateralism, against the international community. So this comes in a moment, political moment for the international community, very difficult. And one of the things that the UN is trying to do, and particularly Antonio Guterres, is and that's why I mentioned our common agenda, that if somebody has not read it, I think it's very interesting to read it, because what the Secretary General is saying is something that we're all convinced, is that we are in a moment where we can have a breakthrough or a breakdown. If we're not able to realize this particularly risky moment that we're living in the world, we can have a breakdown, and we are not going to be able to really sustain the planet, humanity, as we should. So I ask myself, I'm so convinced of that. But the question is, how do you convince people? It's not only about, because I have to say, for the first time when the Secretary General presented our common agenda to the General Assembly, it was welcome. I mean, it's not very common that the whole General Assembly welcomes the document. Usually some welcome, some take note, some, it's much more nuanced, but this, everybody welcomes it. So you should expect, okay, if everybody welcomes, it means they agree with this, and that they will push forward then towards all the things that in the documents are identified that are key to solve the problems of humanity, but still it's not happening. So the question that I have myself many times, dealing with issues like environment or issues with economy or what else, or women's rights and now human rights, is we need to think that we have some issues there, because one of the problems with the political leaders is that the times in politics are usually the times of during elections, and that means that many times they're not very strategic. They think on how I'm going to be reelected. And that's a problem, because it's not aligned to how they define their priorities. Of course, some people do, but many people don't. So I think one of the main important things to do is to try to identify, and I have used that in many parts of my life, and sometimes it works, sometimes it doesn't. How can we convince political leaders that this is the right thing to do, but it's also the smart thing to do? And for example, when we were talking about social protection, when I was working on the social protection floor with ILO, is how do we show them that it's much more expensive, the cost of undoing than the cost of doing? And the same with environmental issues. How much do they show them that is much more costly, much more terrible not to do what you have to do than to do it? You will mean some cost, but it will mean lots of positive consequences later. So I feel that it's not about good speeches. I feel we need to continue doing the speeches, trying to convince leaders. And the other thing is that I feel that we have had not great leaderships. There has been a test of global leadership. Because I'm a woman who always use the words of Desmond Tutu who just passed away, that I am a prisoner of hope. I wanted to believe that the pandemic could create the same sense in leadership that the two world wars created, to say, look, this is so awful, we cannot live this anymore. We have to learn the lessons. I was hoping that the pandemic would create some effect. Unfortunately, it has not. And the answer to your question is not easy, but I think we need to think how we can show clearly that this is the right thing to do, but particularly the smart thing to do if we want to survive as humanity.
Thank you, Michelle. And again, some really fascinating comments. And looking at the questions and answers, or in the Q&A function at least, there are a number of comments that touch on what all three of you have said. So let me try and wrap up some of that as well. But before I do that, I just want to pick up one of the questions that I've been asked many, many times over my career as a former UK civil servant, and more recently, when I'm talking to young people, they say, how do you do this and how do you do that? And one of the key questions is, how do you get political traction? Because that's the vital step to make the sort of changes and the progress that we're all talking about. And Michelle, you just talked about this small window around elections and the electability. And you also, I think, very eloquently talked about what really is World War III, the pandemic. I mean, we've got 2 world wars, and this is a war that we're all immersed in, and we're fighting very hard at the moment. So it is a time where very major political change at a global level can be achieved. So there are some little silver linings, if you like, if we're going to take anything positive out of the current global situation with COVID-19. And I guess the talking is the minimum. It's the starting point. If we don't talk, we'll get nowhere. So for those people that say, well, there's too much talking, well, that might be the case, but at least with talking, there is an opportunity for something to happen. And after all, that's where many of us have made our careers over a number of years. But I think the question I'd just like to come back to here in the Q&A is a suggestion that I've heard many times before. Let's have a new structure. Helen mentioned I think the Global Health Council, the recommendation from the independent panel on pandemic preparedness and response that she co-chaired with Ellen Johnson Sirleaf. That's a great suggestion in many ways. If I look at it in a different way, it's one suggestion. It resonates with a lot of the thinking currently, but in the chat box, it says, in the Q&A, what about a third incarnation of the United Nations? And you've all worked or are working in the United Nations. What do you think about that? For me, sometimes it feels as if, why have a new incarnation when you can improve what is there? That's one way of looking at it. On the other hand, if what is there isn't working and people have tried hard, yourselves included, to change it, well, should there be a radical rethink and a third incarnation of the United Nations? So before we move on to other points, could I just come back to you briefly? A lot in that. So Helen, over to you first, please.
Yes, I think the third incarnation is too big an agenda. Although, having said that, I think Antonio Guterres's Our Common Agenda report actually does put a lot of big and very important ideas out there. And it's important that we back that. And among those big and important ideas, he talks about trying to get agreement on what are global public goods that we all need to share. And he specifically references the health area. So that's definitely an angle to hold on to. But I think the reforms that need to be done to be more effective at pandemic preparedness and response, that they're not mega reforms. It's generally conceded that in order to support the poorer countries, the low-income countries, to be prepared, you're talking about $15 billion at most a year. I mean, this is the petty cash of the international community. And then you need the kind of facility that can leverage up to $100 billion a year in the event that the worst happens and the threat actually emerges. That too pales into insignificance when you look at the trillions of dollars of loss to the global economy from letting a pandemic run away. So the financing of a more effective response is entirely possible. The World Health Assembly has agreed to begin negotiations on the new legal instruments. Whether they end up strengthening the international health regulations, whether they end up with a framework convention under the WHO constitution, who knows? But there are things that could be improved, and hopefully faster than the 2024 timetable. Then there's this issue of the global public goods platform for the future. And, what I would like to see on my wish list would be the World Trade Organization agreeing that when the WHO pushes the pandemic alert button, or the public health emergency of international concern button, that all bets are off on intellectual property. We all pile in to make the goods available to whoever, wherever needs them. That's the gold standard, is what we did with HIV. I think the strengthening agenda for WHO is extremely important. And part of that is the financing, which is being discussed at working groups and probably at the executive board as we speak right now. only 16% of the base program of WHO is funded by member state contributions. It's kept on very short rations. And Margaret, you know that so well. I used to say you get what you pay for. Pay it properly so it can be strategic and independent. And the last point I make about the governance is if we had something like a Global Health Threats Council, however constituted, of high-level heads of state and government, sort of rallying the troops in support of the international institutions, the national responses, I just think we'd be in a better position. I think WHO has, in a way, been left to cope with something that is not easy to deal with just at a health sector level because it has so many ramifications. So fixing this shouldn't be a huge mountain to climb. It is feasible. I think we just have to keep talking about the practical things that need to be done to do better next time. If you can build confidence in getting this right, maybe it will help with climate change. Maybe it will help with other things. It could be seen as a trust and confidence building measure. Sorry to go on, but it is a matter I feel very passionate about.
Yeah, I can see that. And I think many of us online today do feel passionately about it. I think a key word there is practical. And I think one of the points in the Q&A is about granular mechanisms, but we could describe that as practical changes, practical things that can be done. And sometimes we spend so much time talking at the very top level, it's really quite hard to get into the actions that I know we all feel are essential. Margaret.
Well, I think, Helen put out a lot of good suggestions. I think we must seize this opportunity. And I will not refer to the opportunities she mentioned from the different practical solutions. But I just want to make the comment. From experience, no political leader wants to fail. They all want to succeed. But we need to give them the ammunitions to succeed. Now, many people were saying that the pandemic is only a trial. The climate change is a real test. So I would urge there is a sense of urgency for all of us to come together and work together to reform all the multilateral organisms that is required to get things done for the sake of people of this world. That's all I want to say.
Yeah, thanks very much, Margaret. Let me begin to wrap up this discussion. Interesting as it is, we could talk all day, I know, and much longer.
But David, may I say a couple of things on this discussion, please?
Yeah. No, I'm going to come to you now, Michelle. That's exactly what I was going to say. Over to you, please.
Well, yes. Well, first of all, as Helen was mentioning, in the Common Agenda, the Secretary General calls not only for a new social contract that could rebuild trust inside nations between the people and the people and the different institutions. And we have seen the lack of credibility of people with the politics, with institutions, etc. But also he has called for sort of a new international order, if I may say, so we can include insights in places where people are making decisions, sectors of the world who are important but are not there represented. I also call for like an expanded, if I may say, or strengthened multilateralism and the UN, because people try to think on the UN as us, the bureaucrats. But the truth is that the UN, the one who makes decisions, are member states, are the 193 member states of the world. So the truth is that we need also to understand that it should be not only the UN as an organization with the member state, but also include other stakeholders, much more participation on the young people, on women, on civil society, on trade unions, of private sector, etc., scientific world. So, because if we want this political traction, and even if people want to be elected, and even though, of course, they don't want to have to make mistakes, you need to bottoms up always, also to tell them, look, this is what we need, this is what we want. And I think, and I agree with Helen, that health can be this more practical and more, if I would say, agreed area where we could push forward. But to be honest, I think we have some structural issues that won't be solved through reforms of the UN institutions. I mean, reforms have gone on, a lot has been improved, etc. But I believe we do have a geopolitical and structural problem, because this is not only about pandemic, it's about environment, it's about, you see, let me mention Myanmar, for example, 1 year after the coup, terrible violation of human rights, and no decisions are taken in certain places where they should be taken to have actions that could really improve the people in Myanmar who are suffering. Or I can mention Syria. So what I want to say is that we can and try, because I think it's easier in terms that everybody sees the direct effects and there are more universal effects and not a country-specific situation, how the pandemic is affecting everyone. And maybe we can try to get into certain agreements that can improve things. And of course, you can make all the changes that Helen and Margaret were mentioning, the ones I was mentioning about the waivers in the WTO and others. But to be honest, I think in some minute we need to discuss much more. And that's what the Common Agenda pretends, is to say, look, if we continue this way, if geopolitics is the one who at the end makes decisions, and we're not able to think on the whole humanity, we're going to break down. So I think it's true. We cannot have these only high-level discussions, but we cannot be naive, because small little things won't change dramatically, unfortunately. So I think we most need is leadership. And I'm feeling lack of leadership, of global leadership. I mean, the UN does what it can, but we cannot decide on the decisions that member states have to do. And that's our call to them, to stand up for humanity. Sorry to be so honest, but that's my feeling.
No, thank you, Michelle. And honesty is very good indeed. It's what we really are looking for. It's necessary. And I think in creating the narrative that we all know is essential to capitalize on a moment when it arises. In political terms, it's always good to have something ready to put in front of a national minister or a global leader. You know, it's unforgivable to have all of this energy in the system and then to be unprepared to have the conversation if that opportunity arises. So I'm completely with you on that. We're almost out of time, I'm afraid. I was going to move on. I thought it's bad time management on my part, but it just demonstrates what Helen was saying about the passion, which I know all three of you feel. You live and breathe these issues. So we've really touched on many, many issues under this sort of general question of global solidarity. One of the questions that I was going to come back to in the Q&A was about the role of Big Pharma. But in a sense, Michelle, you've just picked that up very eloquently again in saying it's more than the, if you like, the countries and the member states, the UN or the multilateral organizations. It's about working across private sector, civil society. This is such a good example of where that combined multi-sectoral approach is at the heart of making progress. I also had questions in mind around the Sustainable Development Goals, but I think, Helen, even when you started talking, you said that something along the lines of we've made progress. There was an enthusiasm there. I think we started in a very upbeat way, but so much remains to be done. So I'm afraid we have about a minute or so left, which means that what I will do now is just turn to each of you. If you have any parting shot that you would like to leave us with, any particular words of wisdom before I then just draw the session to a close. So let's stick with the same order and come to you first, Helen, please.
There's an old saying, without hope, the people perish. which is unthinkable. And I think we owe it to the children who were speaking before, that generation, to do our best to try and turn this round. We're not short of agendas, WHO is not short of resolutions. We know the way to go. We should see the Sustainable Development Goals as a roadmap for taking us forward. So let's not give up hope. That would be hopeless. We have to try to keep rallying people to, move the right agenda forward. That's my message.
Thanks, Helen. Margaret?
Thank you. Well, I hope, joining the children, I hope 2022 is a year of breakthrough and not a year of breakdown. Yeah. Michelle, thank you for giving me those two important words. Thank you.
Thanks, Margaret. Michelle?
Oh, well, of course, as I said, I'm a prisoner of hope. So we can do it. We know what needs to be done. Let's walk the talk.
Thank you. That's an excellent point on which to end the session. 3 excellent points, but I think hope is the word. And I sometimes say, misquoting, I'm sure, but quoting, I always thought it was Churchill, but I discovered not so long ago, the quote goes back to Machiavelli, about never letting a good crisis go to waste, or something along those lines. Well, if ever there were a crisis, we have one now. But as Margaret said, climate change, this is the test. This is almost a dress rehearsal. How do we deal with these huge issues around environmental degradation? So we're out of time. I'm not going to try and pick out any gems. They're all gems. I'd like to echo the words of Dr. Tedros, both in his opening comments, but also he said on Monday at the opening of the 150th session of WHO's Executive Board, he said, how many times have we said equity, equity, equity? And it's true, but he said it can be a reality. If there's a will, there's a way. If that's the world we want, we must start working for that world now, and it will take vision and, very importantly, partnership, and it will take negotiation, compromise, and sacrifice. And I think we should keep these words very much at the forefront of our minds as we look to take forward the goals that our distinguished conversationalists have spoken so eloquently about today. So with that, it just remains for me to say a very big thank you to Helen, to Margaret and Michelle. It's been a pleasure talking with you. Thanks to all of you who are online. Thank you for joining us. So once again, thank you to everybody. And that's closing the session. Over.